In this video, I'm going to talk about varicose veins. This is an incredibly common condition and can cause either no symptoms or an extent of symptoms through aching, itching, discomfort, throbbing pains in a leg, and sometimes more serious skin complications. Varicose veins affect the legs. They're veins that have enlarged. As they've enlarged, they've often elongated and become twisty or knotted in appearance. These veins were smaller veins originally with a system of intact little valves that allowed blood to return against gravity back towards the heart. But where varicose veins develop, those valves have given way. We call them incompetent. And when the valves give way with gravity while standing or sitting, the veins are under pressure. There's a gravitational pressure in the blood, and this causes the veins to become more engorged and enlarged and are associated then with these symptoms. Treatments for varicose veins have changed hugely over the years. It used to be that the only treatment available for varicose veins were surgical treatments, where these abnormal veins were removed surgically. The treatment targeted the highest source of the varicose veins, and this was often an operation called a high tie or a tie of veins and a strip of the vein, because there's a larger underlying vein in the fat layer in the leg which had to be removed. The treatments have now changed, where we do much less of the removal of varicose veins, and veins are treated more commonly from within by techniques which we call endovenous, meaning inside the vein. Starting at the simplest level, these may be injections, non-surgical treatment of veins, where a chemical can be mixed with air that's visible on ultrasound. And this technique, called foam sclerotherapy, is very effective for twistier veins, recurrent varicose veins for patients who've previously undergone surgery, and sometimes is the best option and a very cost-effective option for primary varicose veins. Moving up, we have techniques where we use heat on the inside of the vein, using very refined little needles and cannulae to seal or ablate the vein from inside. And this heat is very controlled and acts extremely effectively at sealing the source, the larger source varicose vein, leading to varicose veins that are visible in the lower leg. This can either be using a radiofrequency catheter or a laser catheter. Both generate heat and act in exactly the same way. Unfortunately, we don't yet have treatments available that will shrink veins back to their original size and get the valves to work, but this isn't necessary because we have systems of veins in our legs where this network links together, and so blood will pass through healthy, normal veins, allowing us to seal up or even remove sometimes the varicose veins and leave a much more efficient system of veins to return blood from the leg. So the advantages of these newer treatments are that on the whole, they can be provided in an outpatient setting, and there isn't the need necessarily for a main theatre environment. This has allowed varicose vein treatments to be provided on a walk-in and walk-out basis, with patients usually not requiring much in the way of painkillers afterwards or having to restrict their lifestyle. The veins effectively treat themselves or are treated from within, with recovery over the course of several weeks. These veins can remain a little bit more lumpy or tender during this period of time, but that's uncommonly a restriction in your activities as you recover. Varicose vein treatments provided in an outpatient setting can allow individuals to return to work almost immediately and return to full activities, including sports activities, within a week or two. These endovenous treatments can be used even for very extensive varicose veins. But in some cases, if the veins are very large and very extensive, perhaps affecting both legs, it may be still a sensible option to undergo this endovenous procedure under a general anaesthetic, and that can be combined with a small number of cuts to remove the very large bulging varicose veins. Day-case varicose vein procedures carried out under general anaesthetic usually result in a very quick recovery. It's a light anaesthetic. Local anaesthetic is still applied by the surgeon using ultrasound control, and this means waking up quickly usually with very little side effect from the general anaesthetic or hangover from it, and an early discharge within a few hours and return to normal activities. All patients who do have a general anaesthetic are advised that there should be somebody at home with them overnight following the anaesthetic procedure. But other than this, the recovery really is very straightforward and just as quick as the outpatient-based procedures.